All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer. We're here in our new office in Manhattan.
First live in the new office.
First live in the new office. It's been a busy day, an exciting day, because we have a beautiful patient here today that's just getting a little tweak. We're not doing anything aggressive because he already looks really good. But there's certain things that we notice in male facial sculpting, male volumization that occurs as we get a little bit older, or if there's some weight changes, recent stresses, things like that, where this middle part of the face starts to lose a little volume. It's very common actually in guys in their 20s to notice mid-face volume loss showing dark circles and hollows, and then nasolabial folds or smile lines become more pronounced. So I have a patient here that has a very sculpted lower face, but has some loss of volume in the mid-face. So I want to lift that a little bit, but we don't want to overdo it because that can make men look unnatural, it can make them look feminized, and when you smile or in action, it also can look unnatural. So we're just gonna make it look shaped and just a little bit more balance to his face. And then if I have a little extra, we may do some feature enhancement. He already has really nice jawline and chin, but we can balance it slightly. So we're using radiance. And the reason I like this for him, actually, he has thicker skin. This will allow a little more lift because he's got the thickness in his skin, and will give him a little more volume than the traditional HA filler would. Plus it's gonna last him much longer. The one thing I want you guys to note, when you're using radius, we really want to go on bone, or we want to dilute it to be in the tissue. Was there much pain there or no?
No.
Excellent. That makes me happy. Good.
You can see the difference from one side to the other already.
Great. And so what I'm trying to do is I'm just using a syringe to kind of just give, again, you see here this indentation that was created here, and now look at it. There's very minimal of that indentation. We're actually going to go to the submalar area and give him some volumization as well. A little bit of building in the laterals.
Why not voluma?
Well, I literally just said, you guys, I love you all, but I did just say that HA filler on him would require a lot more of it because he also probably will metabolize it. Guys work out a lot more. Guys that work out a lot, they tend to metabolize the filler a little bit more. Radius, being a calcium-based filler, will allow him to have a little more long-term result with more collagen production and a more initial build in volume than he would with the HA. I love voluma, but it would require a lot of syringes. And again, expense and looking overdone. So that is what I call a scaffolding technique. That's where we layer this in like a sandwich. Bone, tissue, fold. So take a look. You can already see on this one side, big difference from just one syringe.
Wow.
So what was done there was not only working on bone for elevation, but also doing a scaffolding for the tissue, submalar, deep medial fat pad, and bone. So I'm gonna come to the other side, and we're gonna do that same thing. One thing I want people to see, Jordan, if you can show this, is look at right here, and then look on this side. Look how you don't see that line or that hollow. This triangular area is now gone. It's awesome. I'm gonna be really happy. So we call this dimensional contouring. This is where you're actually lifting tissue and creating volume. And it's more than just creating a feature. This is really creating a new shape and a structure for him, so he looks rested and youthful, because otherwise it's gonna make him look older than he is. We don't want that. Again, we're addressing all the areas of this middle face triangle, the piriform aperture, the deep medial fat pad, the submalar area, and bone. All of it being addressed with this one syringe of calcium hydroxylapatite. So you can see again, now more balance to the other side. This looks great. That's just one syringe aside. Very conservative improvement, which we can always add more. I think it's a good starting point. We're going to use our last syringe for some contouring. Now we'll use our last syringe just to kind of balance everything. Want to do just a teeny bit more into this pad below the eye. Again, if we're on bone, we're really safe in terms of getting a nice result. Very good. We want to keep that structure, and then what I want to do is just add a little bit now to balance out his chin, because what this is going to do, this structure here will go right into this contour, and it'll make him look super chiseled, model-esque. You want to overdo smile as big as you can now. That's great. You see, so now we don't see those lines anymore. I think that's awesome. And now let's build out a little bit of width on the chin. This is going to be our kind of cherry on top. Because he already has, I feel like his jawline is really nice already.
Is this a permanent procedure? No, it's not, but we do offer permanent solutions if you're interested in that as well.
And there are things like chin implants, there's things like using a filler called Bellafill or PMMA that we can use. I'm really excited to show them because I think this looks amazing. Really good. No one would ever know they had it done except for if they watched the live. So, all right, let's give him...
Let's do the Emer reveal.
Yeah, do the Emer reveal first, George.
All right, so we're going to hand you the phone.
Okay.
You show us your real life reaction if you like it. Tell us if you hate it. Tell us.
Or don't tell us, either one. No, I'm kidding.
Okay.
I haven't had anyone hate it before.
Okay.
All right,
All
take
right.
the phone, lay back 45
All right,
degrees, and then
there
hold
you
it
go.
there so you can actually see.
Grab my
the
phone. Grab my phone. Take a
Now
selfie.
look. Oh, hold on.
That's my fault, sorry.
It's okay. We'll get back.
There we go.
Now,
Ooh.
what do you think? Hold
Oh
on,
my
let me clean it.
gosh.
Let me clean it a little bit more so you can see it more clearly. Zoom in a little, like come in a little bit, see what you think.
Oh my gosh, it looks so good.
So here's what we did. Before you had this sort of what I call like this sad area, where it's got like a sad face because it's coming down. But now we're adding some volume in this, what we call this mid-face triangle. It's like this, where this whole area is supported and lifted. The fold, the mid-face, lateral cheek, and the submalar area. All this is, so that's why when you smile now, you have that nice kind of roundness, but we didn't get rid of the sculpting, because that's what we want. We want to keep the sculpting. The sculpting now goes into the wider chin. So if you take a look, you can balance, we look even straight on, you could see this right into the chin. So that's the boldness to the chin now has the contour to the cheek. What do you think?
It looks really good.
I love it. So now let me show you here in the mirror because it looks a little bit different.
I'll take my phone.
And then you tell everybody what was your goal? Like what was your goal?
My goal was to like just fill in the volume that was lost in my cheeks, and I feel like it really did that. I feel really
Better.
Yeah, I feel
Just looks more young.
yeah, much younger, like awake and alive.
Perfect. I love that. So less tired, you guys, less tired looking. And I want to tell you something. It's not always an age thing. A lot of people think, oh, if you're getting fillers, you need to be older or you need to use it and it's going to look unnatural. It doesn't look unnatural. You could lose weight in your 20s, 50 to 100 pounds. You can have weight loss in your face. You could be running a marathon. You could lose weight. You could be on Ozempic peptide and be losing weight, and it causes that to change. So this is not an age thing. It's a facial genetic thing, and it's also related to lifestyle. So you guys can see we're going to do a quick pan, and then that's it. We achieved his goals. Our first great live from Manhattan. Looks good.
Looks
Perfect. Yeah, it looks amazing.